Today we'll be talking about Ebola and malaria.
My name is Lori, and I'll be talking about Ebola.
And my name's Brenna, and I'll be talking about malaria.
Ebola is a viral infection known as the hemorrhagic fever virus because it can cause clotting issues in the body which lead to internal bleeding. Ebola is caused by viruses belonging to the genus Ortho Ebola virus, which is a member of the Filoviridae family. The Ebola virus genome is a 19 kilobase long, linear, single-stranded, non-segmented negative sense RNA molecule that contains 7 genes coding nucleoprotein, viral protein 35, VP40, glycoprotein, VP30, VP24, and the L protein, which is an RNA polymerase. It has a helical nucleocapsid shape, and it is classified as an enveloped virus due to its outer lipid membrane. The envelope protects the virus's genetic material as it moves between cells. Its surface contains spikes formed by viral glycoproteins, which then arbitrate the critical binding of the viral envelope with a host cell's membrane, allowing the virus to release its RNA and initiate infection. Scientists believe that African fruit bats are involved in the spread of Ebola. These fruit bats spread the virus to other animals through contact with infected body fluids or items contaminated by these fluids. There is also animal to human and human to human transmission. Fruit bats spread the virus to other animals, which then spread to humans through contact with their blood, bodily fluids, or organs. Then it can spread from person to person via direct contact with the blood or bodily fluids such as urine, saliva, and feces of an infected person through broken skin or mucous membranes. Transmission also occurs through contact with contaminated objects, surfaces, or clothing. Signs and symptoms start 2 to 21 days after being infected by the virus. However, symptoms regularly begin to appear 8 to 10 days after exposure. In the early stage of the virus, one will experience dry symptoms like the flu, such as fever, chills, aches, abdominal muscle pains, and fatigue. As the illness progresses, the person becomes sicker, displaying wet symptoms such as diarrhea, vomiting, and unusual bleeding. And this unusual bleeding can happen internally or externally. Some patients have blood in their vomit and feces, and some women develop bleeding in the vagina. Symptoms such as confusion and aggression confirm the central nervous system is also being affected by the virus. Ebola progresses from flu-like wet and dry symptoms to severe life-threatening illness. Late stages can lead to brain inflammation, seizures, septic shock, and multiple organ failure, causing death. The virus attacks the immune system, and without quick medical care, these severe complications can be fatal. The 2 FDA-approved treatments that are currently available to treat Ebola virus are Imneseb and Ebanga. They are monoclonal antibody therapies, which means they are proteins produced in a lab that mimic the body's natural antibodies. Ebola also relies deeply on supportive care to manage dehydration, oxygen deprivation, and low blood pressure. Dialysis is one of the treatments needed to support kidney function while the patient recovers from the disease. Medical care workers will check your blood pressure regularly, perform blood, urine, and other tests to see how the organs are doing, and look out for any signs of the virus, whether they remain or disappear. Without treatment, 90% of Ebola cases are fatal. The Vervo vaccine is recommended for when there is an outbreak of the virus or in high-risk situations. If you are staying or living in a region or travel to where the spread of the Ebola disease exists, make sure you avoid contact with body fluids from people or animals. Always wear protective equipment if you plan to encounter people who are sick or have died from Ebola, and don't touch personal items of a person with Ebola. Strict hygiene is always important. Always wash your hands. Don't touch your eyes, nose, or mouth with your hands, and if you do, wash your hands first. Make sure to monitor your health for 12 days when you return from a place that was exposed to an Ebola outbreak. Seek medical care right away if symptoms of the Ebola virus start to appear. Ebola was historically uncommon, only causing random contained outbreaks in Central Africa. It wasn't until the unprecedented 2014 to 2016 West Africa outbreak where there were over 28,000 cases reported. Since 2024, the number of cases is way smaller, with 64 cases as of this year and an ongoing localized outbreak in the Democratic Republic of the Congo. The health organizations learn from past outbreaks and know how to develop faster response systems to control the spread of the virus. The Ebola virus was first discovered in 1976 in the Democratic Republic of the Congo. Ebola is most common in countries such as the Democratic Republic of Congo, Uganda, Guinea, Liberia, and Sierra Leone because they've had the most outbreaks since 1976. While this infection is not more common in a particular gender, it has often been amongst health and care workers who were infected while treating patients with Ebola. Risk is not limited to a specific age group or ethnicity, although certain age groups may have higher occurrence rates depending on the certain outbreak. In the 2022 Uganda outbreak, the highest incidence was seen in the working age adult population between ages 20 and 39 due to their high risk of exposure, which is correlated with behavior and occupation. The CDC website has a lot of information on many Ebola cases and outbreaks, and they are all organized by year. I decided to focus on the first ever documented 1976 Ebola outbreak. This outbreak took place in Yambuku, a village in the Northern Democratic Republic of the Congo, near the Ebola River. The initial transmission is believed to have been from an animal to a human, possibly a fruit bat. An infected person was treated at Yambuku Mission Hospital with an injection for possible malaria, and unsterilized needles were used, causing the Ebola virus to spread rapidly through human-to-human contact. This outbreak saw 318 cases, of which 280 died and only 38 survived. The disease was not immediately identified because health workers initially thought it was a severe form of malaria. At the time of this outbreak, there was no specific treatment available. Medical experts from abroad, including those from the World Health Organization and the CDC, were brought in after the high rate of fatalities. Care was limited to supportive measures, and quarantine was forced to stop the spread of the virus. The outbreak was contained with proper protective equipment, strict quarantine measures, and the discontinuation of unsafe injection practices. It ended relatively quickly due to effective infection control by medical experts. Interesting fact, there are 4 species of Ortho Ebola virus that cause illness in people. But did you know that there are some species that do not cause illness in people? The Reston virus can only cause illness in non-human primates and pigs, so humans are safe from the Reston virus.
Malaria is a protozoan infection caused by Plasmodium falciparum and has a wide range of symptoms. Malaria is mainly spread through mosquito bites from female Anopheles, but can also be spread through blood transfusions or by the use of contaminated needles. P. falciparum appears in multiple stages, but is most commonly seen in the ring stage, where they appear in a headphone-like shape when observed in red blood cell stains. While this is the stage that they are most often seen in, they can also be in the other 3 stages, which are gametocytes, trophozoites, or schizonts. The signs and symptoms of malaria will vary from patient to patient depending on the severity of their case. The most common symptoms seen are very similar to those of influenza. This includes fever, nausea, and weakness. But if the case is more severe, then some symptoms that may occur could be bleeding, severe anemia, seizures, jaundice, and circulatory shock. Malaria should not go untreated because if left untreated, there could be fatal consequences. Death is likely, but some other deadly issues that may arise could be cerebral malaria, which are blocked blood vessels in the brain, organ failure, or coma. Malaria should be treated as soon as possible, but there may be cases of prolonged treatment due to location and what is accessible. Some antimalarial drugs that can be used to treat the infection are hydroxychloroquine, atovaquone proguanil, doxycycline, or primaquine. Malaria is very easy to contract as it is mainly spread through mosquito bites. But here are a few ways to reduce risk of infection. Try to keep as much skin covered as possible, sleep under a net to keep out mosquitoes, take the malaria vaccine, or speak to your healthcare provider about what preventative measures should be taken before visiting a high-risk area. Some recent prevalence of malaria was in 2023. Malaria cases worldwide were estimated to be around 260 million, with an estimated death toll of 600,000. Some past prevalence was between the early 2000s and 2010, around 500,000 people died a year due to malaria. But the U.S. has reduced the risk of outbreaks due to their eradication of malaria in the early 1950s. Malaria outbreaks are most often seen in the World Health Organization's African region. This includes 47 different countries. Malaria is most common amongst children under the age of 5, pregnant women, and people with sexually transmitted diseases. It can be very difficult to find individualized cases of malaria due to the fact that it infects so many people, so I decided to look at the largest outbreak I could find. In 2023, there were over 260 million malarial cases worldwide, and 94% of these came from the World Health Organization's African region, which covers over 20 different countries. They had a total of around 569,000 deaths, 76% of which were children under the age of 5. Symptoms would usually occur 10 to 15 days after initial infection. This was a mass outbreak, but thanks to early detection and treatment using the malaria vaccine, the death rate decreased and the outbreak came to a close. Here are just a few interesting facts about malaria. Did you know that if you've had malaria before, you can contract it again without even being bitten? Malaria has dormant liver parasites that can be inactive for weeks or even years, then sporadically become reactive and bring about a new episode of malaria. There are also certain protozoa that are more likely to cause a relapse if contracted. Here are some questions about both infections that we presented over today.
Is asymptomatic transmission of Ebola possible? What is an antimicrobial product that's effective against Ebola? Can Ebola stay in the body after recovery?
Are there ways to stop malaria from happening? What should you do if you contract malaria? Where are you most likely to contract malaria?